My guest today, Dr. Thomas O'Brien, is an internationally recognized and sought-after speaker and workshop leader specializing in wheat, its impact on health and the development of autoimmune diseases as they occur inside and outside of the intestines. In November in 2016, Dr. O'Brien released Betrayal, the Autoimmune Disease Solution They're Not Telling You, an investigation into the global effects of issues underlying the autoimmune system and chronic diseases. Over 500,000 people worldwide have watched the docu-series. And just to let you know, driving back from North Carolina this weekend, I listened to it all. You know, that's what I did during my 14-hour trip driving back from North Carolina. I listened to your whole docu-series. And like I said, it was fascinating. So, and hopefully we can kind of circle back to that a little bit. Tom holds teaching faculty positions with the Institute for Functional Medicine and the National University of Health Sciences, my old motto, obviously. He has trained and certified tens of thousands of practitioners around the world in advanced understanding of the impact of wheat sensitivity and the development of individual autoimmune diseases. His 2016 groundbreaking book, The Autoimmune Fix, won a National Book Award and ranked first in several categories on Amazon. Dr. O'Brien is founder of the Doctor.com and a visionary behind the Gluten Summit. And just kind of a little, the Betrayal Series, like I said, was fascinating. I thought I knew a lot about autoimmune illness and what little kind of information that I had, but between your Betrayal Series and your the Autoimmune Fix, I was blown away with what I didn't know. And so I thank you. I thank all of your, dozens and dozens of guests, that did that series for you, because it definitely enlightened me and educated me tremendously, not only in autoimmunity, but, the causes, obviously going back to the intestine, the environment, the lifestyle, things like that. So thank you for doing that, because it really enlightened me in terms of what I didn't know in terms of the autoimmune spectrum, and how the microbiome in the gut plays such a role in that, and what I can bring to my clients and to my patients. So kudos, you guys.
Well, let me just comment on that, if I may. Thank you very much for the compliment. And unfortunately, that is the situation in healthcare today, that our medical doctors, a survey done by the American Association of Autoimmune Diseases and related disorders, they did a survey of general practitioners, and they found that the average training in medical school on autoimmunity was 2.5 classes in their 8 years of medical school. 2.5 classes. That's not 2.5 courses.
Classes.
That's 2.5 classes. So our doctors just have not been trained on this big picture. And hopefully in this interview today, what everyone will understand is how important it is to just consider this mechanism. Is this going on in my body?
Right. And to follow up on that, when you talk about that training, they probably get as much, if not less, nutritional education. In terms of, just what's a carbohydrate, a protein. I mean, they probably even get less education or training in nutritional protocols.
Well, you may remember when you and I both were practicing in Chicago many years ago.
Yep.
I was president of the Chicago Chiropractic Society, and we pushed for the legislation. In the state of Illinois, the medical licensing board covers medical doctors, chiropractic doctors, and osteopathic doctors. It's the same board with the same requirements to sit for a licensing exam.
Right.
And there were no requirements for nutrition courses at all for any doctor to sit for the exam in the state of Illinois. And it was the chiropractic group that pushed for a minimum of 2 courses, for a minimum of 2 courses for every doctor, medic, osteopath, chiropractor, for everyone that wanted to practice in the state. They have to take at least 2 courses so that they know what nutrition is and what good foods are, some basic stuff.
And two courses being what, maybe an hour long?
Well, two courses. It was 3 credit hours, so that would be an hour 3 times a week for a semester. So 2 courses, 1 hour, 3 times a week for a semester.
Okay, well, and as you know, that's nothing.
Well, it's not enough, but at least it's something. But to your point, that our doctors, it's just not part of the training.
Right.
They just don't get it.
Mm-hmm.
So it's not their fault until they have the opportunity to learn more. And then if they choose not to,
right,
and poo-poo something that they just don't know about, well, then that's a problem.
Right. And all of you guests, I don't know how many guests you had on the Betrayal Series, but they all made a point of saying that, these people are not bad people. It's not that they go into medical school or whatever school that they go into thinking, I'm gonna hurt this patient. I'm not gonna do this because I really want to not have the best outcomes. I mean, they just don't know. Their training is not in that field, and it's not that they're trying to really, consciously harm someone. It's that they just don't know that much about nutrition or clinical nutrition or integrative nutrition to take that to a next level. So if they're not bad people, they just don't have the right training.
The importance is, just so people understand, it's not fair to ask the average doctor any questions about nutrition. It's not fair. They just don't have any training.
Right.
They don't know. Or about autoimmunity. They really don't know. That's why it's so important just to get a baseline of information on this.
Okay. Now, on a personal note for you, I've known you for several years, and you could have gone many different directions in terms of all the different health crises that are out there. All right. Obviously, autoimmunity, and obviously gluten sensitivity. The wheat sensitivity, the celiac can kind of tie into that, but we have neurocognitive disorders, diabetes, heart disease, cancer, which obviously I have a little bit more of a interest in. Why autoimmunity with you? What is it about autoimmunity that you finally just said, aha, this is where I want to go, and this is where I'm going to dedicate the next 20, 30 years of my life?
Really good question. Thank you. My father died at 66 at 64 of a massive coronary, out of the blue. I'm 66, and when I turned 65, my brother called on my birthday, but I wasn't home, so he called up and, well, congratulations, you outlived Dad, and he hung up. So that was like,
wait a minute, is that how you found out about your father passing away?
No.
Oh, okay.
On my birthday. I'm just making a point here that, we're all living on borrowed time to some degree. Right. We all are. We all are. So for me, what can I do that will have the greatest impact and help the most people in life? What is it that I can do? And I realized many years ago that seeing patients one-on-one in my practice was very fulfilling and great for 25 years. But then I said, you know what? So many of my colleagues aren't familiar with this information because I'm a geek. I've been reading these studies week after week after week, year after year after year. And so I've accumulated a lot of information. And I really want to share this with my friends. And so I decided to talk about it, to give a talk, a lecture. And I started in 2004 with the International American Academy of Clinical Nutritionists. And that's where it started, and people were just so blown away. And it was such a paradigm shift for people, for the doctors. They just changed the way they thought about wheat. When I did this presentation, I realized that this is a venue, this is a vehicle where I can reach hundreds of people at one time who all reach thousands of people every year. So we can reach hundreds of thousands of people if I devote my time to putting this kind of information together in a way that can be taught to the world. So as I did that, and as I learned more and read more, the problem is not wheat. Wheat's not, so it gives you, a little tummy ache. That is not the problem. The problem is when you develop a sensitivity to wheat, it's going to manifest wherever the weak link is in your chain. You pull at a chain, it breaks at the weakest link, always. Right. It's at one end, the middle, the other end. It's your heart, your brain, your liver, your kidneys, wherever your weak link is. That's where the chain's going to break. So, and that's determined by your genes and how you've lived your life up to this point, meaning it's called your antecedents.
Right.
What has set you up? If, for example, if you eat tuna fish 3 times a week, you're going to have a problem with mercury.
Mm-hmm.
That's an antecedent.
Right.
And then your genetics, if you have genes to have vulnerability to brain dysfunction, the mercury may accumulate in your brain, and that's where it's going to show symptoms. Yeah. And you've got brain fog, and you don't remember properly, and you start to lose brain function. Mm-hmm. So pulling at the chain, it's going to break wherever your weak link is. That's the problem with wheat, because wheat sensitivity is the pull on the chain. Mm-hmm. So the first rule of thumb is stop pulling on the chain. So your genes are important in autoimmunity. The research says about 30% of autoimmune diseases are determined by your genes. Right. The rest of it, the majority of it, is what's called epigenetics, around the genes. What's happening around the genes? What are you putting in your mouth? What kind of air are you breathing? What are you putting on your body? What's happening around the genes that turns the genes on or turns the genes off? That's called epigenetics. And so the whole world of autoimmunity, because the vast majority of autoimmune diseases can be controlled, and the words that the scientists use is arrested. You can arrest the development of autoimmune disease when you take charge of these epigenetic factors. Mm-hmm. And the most important one is what's on the end of your fork. That is the most important epigenetic factor, because what you put in your mouth goes into your gut, and that is what turns genes on or turns genes off. Right. There's more to it than that, of course, but that's the primary one, is what's on the end of your fork.
Now, when you talk about the epigenetics of what's on the end of your fork, obviously you have, and you're in your environment, what toxins you're being exposed to. You have stress, how much cortisol are you producing, in a stressful environment. So do you still think with all these other contributing factors, with the epigenetics of cortisol, stress, environment, toxins, lifestyle, lack of exercise, all these other variables, you still think that what you put at the end of what you have at the end of the fork is the most important epigenetic in terms of manifesting towards some type of disease?
Well, that's a really good question, and the answer is, in general, for the vast majority of people, absolutely yes, absolutely. But there are some situations, for example, we know there's 5 different types of Alzheimer's, and one of those types of Alzheimer's is called inhalation Alzheimer's. It's what you're breathing that's causing the inflammation in your brain. Mm-hmm. I'll talk about that for a little bit here. Back in the 1990s, studies came out of Mexico City. Every dog that they did autopsy on, every dog had evidence of Alzheimer's in their brain. Every dog.
No matter what age, breed, location, doesn't matter.
It's what they're breathing. It's what they're breathing. In the 2000s, mid to late 2000s, they started having blood tests and urine tests that could identify the mechanisms of Alzheimer's. Every child in Mexico City, every single one, has evidence of the inflammation that triggers Alzheimer's. Mm-hmm. Every single one. So in that environment, air pollution is critically important. So what do you do if you have air pollution problems where you live? You get the very best air filtration system possible for your bedroom, because that's where you spend more than a third of your life, right? And then second, the air filtration system for your office where you work, because that's where you're going to spend 8 hours a day or more, right? Yep. So in general, food is the most important, but in some environments, some situations, other triggers to the inflammatory cascade may be of primary importance.
Okay. All right. Now, one of the things I want to talk about, and again, we're kind of getting some basic information here, and I think most people have heard of them, or maybe not. The innate immune system as compared to the adaptive immune system. And I think some people read it, but they don't kind of really know what exactly that means. So if you could just kind of explain to people, what exactly is our innate immune system as compared to an adaptive immune system?
Mrs. Patient, your immune system is the armed forces in your body. It's there to protect you. There's an Army, an Air Force, a Marines, a Coast Guard, a Navy. There are many different branches to the immune system, all designed to protect you. The first responders, the local community police department, the first responders are called the innate immune system responders. They come out, and if there's a problem, they've got these 6-shooters, these pistols, and they can fire their chemical bullets to destroy whatever the threat is. But when they are outgunned and they don't have the ability to deal with whatever the threat is, now they've got to call for backup. When you call for backup, that's called your adaptive immune system. The body has to adapt because there's a big threat here that the local police department can't handle, the innate immune system can't handle. So when the adaptive immune system is called out, those are called antibodies.
Right.
And antibodies don't carry 6-shooters. They carry high-powered rifles. And one of the branches of the adaptive immune system in the brain is called the glial cells in the brain. They burst, the innate immune system gets going. If that doesn't do it, then the adaptive immune system, these guys have bazookas.
Right, I remember you saying
You just don't mess with these guys. So it's the most potent response that we can generate is the adaptive immune system. So the innate is the first one that's called out. You eat some raspberries with a little white fuzz on a couple of raspberries you don't see. Well, that's mold. So you eat mold, it goes down into your gut, and the immune system in your gut says, we got to fight that mold. We don't want that to get a hold inside of us, and it activates the innate immune system. When that's not going to do the job any longer, when mold has gotten a hold in your body, now the adaptive immune system has to come out. For example, I talked a little bit about air pollution. If you go on vacation, Mrs. Patient, and when you come home after a week or a little longer than a week, you have to open the windows to air the house out? Oh, yeah. You got mold in your house.
Absolutely.
And you're breathing mold every day.
Along with probably many other things.
I'm sorry?
I'm sorry, along with probably many other things that have built up in a closed-up house.
Yeah.
The outgassing of carpets, the paints, everything else that has kind of been trapped in there.
Right. But you just want to check, do I have a mold problem here? Because if you're breathing mold every day, you can't tell. But when you're breathing mold, it goes right through the nostrils, right up into the brain. And we know that mold infection, now we know, Dr. Dale Bredesen of the Buck Institute, this is the guy that wrote the book, The End of Alzheimer's, came out earlier this year. And he's got over 100 cases that he references in the book, completely reversing card-carrying Alzheimer's patients.
Wow. Completely
reversing it. There's 37 things on the checklist. Do they have this? Fix it. Do they have this? Fix it. Do they have this? Fix it. There's never going to be a drug to fix Alzheimer's. That's so silly to even think of, because it's a decades-long process of causing damage in your brain. So you've got to reverse all of that. But Dr. Bredesen talks about the number one mechanism contributing to Alzheimer's, in his opinion right now, is mold.
Really?
And when you're breathing mold, long term, you get problems in your brain. It's very, very common.
Okay. Now, when we talk about, let's just talk about some of the numbers of autoimmune illness. In terms of, the cost of, what it costs in this country, what it costs our medical care, how we stack up to other countries in terms of the amount of money spent on. Now, granted, I'm sure, we don't like to put a monetary value to someone's health, but the reality is that there's only a certain amount of money that can go around. So if we're looking at autoimmune illness, how much money in this country is actually spent on directly or indirectly in working with people who have autoimmune illness? And my guess is it's staggering.
It's so staggering, it's going to just shock you. To answer that question, you have to understand who has an autoimmune mechanism going on. So when you ask that question, and when you read the science, atherosclerosis, which is the plugging up of your pipes, cardiovascular disease. Everyone thinks number one cause of death is cardiovascular disease. Atherosclerosis, the plugging up of your pipes, is autoimmune. That's what sets it all off. Cancer is autoimmune in its initiating phases. That's what sets it off. So when you just take those, immunologists have known for decades that autoimmune disease is number 3 cause of getting sick and dying. But now with the new science, we know that cardiovascular disease initiates and gets fueled by an autoimmune mechanism. So now, when you look at that, what's the number 1 mechanism in getting sick and dying in the world? It's your immune system trying to protect you. And because it's trying to protect you and the collateral damage from how hard it's working, here come all the different diseases.
Okay.
So the cost is staggering. It's add up the cost of cancer and cardiovascular disease and the known autoimmune diseases, and you start to get a sense of how big this is. Right. That's why it's so critically important that everyone just has a basic understanding of what this means when your immune system's trying to protect itself. That's why I wrote this book. Shameless plug, shameless plug.
I'm sorry.
Fix.
I read your book. I had the book. I had the cover. I was going to bring it in with me, and I forgot. But I finished it a couple weeks ago, and literally it took me 3 nights to read it. It's a fascinating book.
Well, thank you. And that's why I wrote the book, is so people could get the big picture and do an OMG. Oh my God, I didn't know this. Is this why my son is getting so many ear infections? Is this why my husband can't lose weight even if we cut down his food dramatically? Is this why I have migraines? Is this why I've had recurrent miscarriages? The answer is yes. So often. So when people have this big picture understanding of what autoimmunity is, then you start to understand, well, why is my body being triggered to protect itself? Where is it coming from? Then you start to understand it's all of the toxins in the environment. Here's the statistic in the Journal of Pediatrics. For every person in the United States, 250 pounds of toxic chemicals per person per day are being dumped in the U.S. That means for you and I, Dr. Harris, for you and I, that's 500 pounds a day. That's 10 50-pound bags every day of toxic chemicals
are being dumped into our environment. Now,
does
that mean that we're taking in 250 pounds in our bodies, or it's just out there for us?
What we get in our bodies every day is this tiny, minuscule amount that there's no evidence causes a problem, no evidence at all of the mercury that you take in, or the bisphenol A, the chemical that
out of
molds plastic,
yep.
Or the PCBs. There's no evidence that the amount you take in a day is a problem. There's a tremendous amount of evidence that when this stuff accumulates in your body, it's a huge problem. It's a huge problem. That's what your immune system is trying to protect you from most often, is the accumulated amount of toxins that we're absorbing. Here's an example. The Danish government spent 3 years of actively studying this topic. They had a commission of top scientists, and there was no politics in this, in the research on it. Should we recommend that women in a first pregnancy not breastfeed? Why would you ever think of not breastfeeding in a first pregnancy? because this woman, 22, 25, 28 years old, has had 22, 25, 28 years of accumulating minute amounts of toxic chemicals in her body.
Yeah.
These toxic chemicals, many of them are called endocrine disrupting chemicals.
Absolutely, yep.
Hormone disrupting chemicals. They bind onto cells that love hormones. So in women, that's your breast. So women's breasts, before a first delivery, are loaded with endocrine disrupting chemicals. Now the woman has a pregnancy, healthy pregnancy. Now here's a side note. The Environmental Working Group published a study a few years ago that showed every child born in America has, on average, 180 toxic chemicals in their bloodstream at birth that aren't supposed to be there.
I remember reading that in Betrayal, I believe. I heard that.
Yeah,
Yeah.
And many of those chemicals are brain toxins.
Right.
So baby is born really toxic right away. Every baby in the U.S., every baby. But now mom's body has gotten the message, start making some milk, start making some milk. So the lactating cells in the breast start making milk. Those lactating cells are loaded with all of these toxic chemicals she's been exposed to for 22, 24, 28 years. So the breast milk is highly concentrated in these toxic poisons, highly concentrated at levels that are dangerous. So 3 years, the commission studied this, and now the politics come in because here come the corporations trying to influence all this and say, there's no problem with this. This is fine. You know, you can't say that about women because it'll scare everybody and it'll cause a ruckus. So they finally came out and said, you know, the teeter-totter, the pros and cons, it's more important to breastfeed than not breastfeed.
Right.
That was the conclusion. But that's a very poor conclusion to come to. The accurate conclusion is breast milk in a firstborn is very dangerous. Women of childbearing age need to detox before they get pregnant.
Okay.
They've got to clean their breasts out before they get pregnant. But nobody knows this.
Yeah.
And so very few people are doing it.
Now, how does this relate to, I think, again, in your book, that how important colostrum is? You know, in the first 2 to 4 day, you know, after the baby is born, the mother's milk is more of a higher rate of colostrum. Now, if those first few days are a little bit more toxic, how does colostrum fit into that? You know, should people?
That's a really good question. Colostrum is critical. Every dairy farmer knows when a calf is born, you've got to give that calf colostrum or they die. You can't give them milk, the cow's milk. You've got to give them colostrum. Colostrum turns on the gene. See, every baby in utero has tremendous intestinal permeability because baby's living in this soup inside the womb, and you know the eyes and the nose and down the esophagus, you know, down into the stomach and the intestines, and there's no boundaries. And it's just all flowing here. When baby is born, now colostrum comes in. The first 3 to 5 days of mother's breast milk is not milk; it's colostrum.
Right.
Colostrum comes in, and it turns the genes on in babies. Okay, baby, let's close that intestinal permeability now. Let's start building these cells to make enzymes because pretty soon food's coming down. And here's the blueprint of what the food's going to be coming from your mom. Here's the blueprint.
Okay.
So the body starts closing down the intestinal permeability, producing the digestive enzymes. The gallbladder starts getting ready to make bile to digest the fats. Here's the blueprint of the fats that you're going to get, baby. So these are the enzymes that we need. So the genes get turned on for all of these different functions. Colostrum is critical. Now, everything I just talked about, the colostrum is highly toxic. But baby still needs colostrum. So the answer to all of this is women of childbearing age need to detox before they get pregnant.
I would think yes, but no.
Yeah, no, yes, no. The answer is they need to detox.
Yeah, I would think that they would
Before
need to
they get
clean as
pregnant.
much as they can out to have a much cleaner, internal environment to make healthier milk, healthier colostrum.
Exactly, because you think about it, these endocrine disrupting chemicals are brain toxins.
Well,
They're brain toxins. Now, here's a statistic. When I came out in practice, I think I was a couple years before you, Dr. Harris. I
you were.
graduated in 1980. And when I came out in practice, it was one child out of every 4,780 on the autism spectrum.
Right.
Now we know by 2026, it's estimated it's going to be one boy in two
On the spectrum.
on the autism spectrum. That these our kids' brains are being affected dramatically, like the plasticizers, bisphenol A. When babies have bisphenol A, the scientists have shown that bisphenol A inhibits the laying down of myelin on the hypothalamus.
Right.
Now, myelin is the saran wrap around your nerves and your brain. It's there to protect you.
Absolutely.
The hypothalamus is the area of the brain for cognitive thinking and for memory. And so babies are developing a part of their brain that doesn't have the insulation to have a really good functioning brain. One boy in two is going to be on the autism spectrum.
Right.
That's what we're up against right now. It's so overwhelming. I know that people listening to this are going, oh my God, what do I do? What you do is you get this book and you read the book, because we give you lots of little pearls of how to protect yourself, but then you also start asking more detailed questions of your doctors.
Yep.
And they won't know the answers, most likely. They won't know, but hopefully they'll search it out for you.
Yep. So anyone, they can contact you. We're going to have your information at the end of the show, so they can contact you. Whether it be, you personally, the book, the Betrayal Series, so people will be able to get a hold of this. But I highly recommend anyone watching this show, minimally get the book, definitely get the Betrayal Series, and then kind of go from there, because it will definitely put the two pieces of the puzzle together, and I think it will help people in long-term health, and I think they'll be much better off for it if they kind of combine the two. You have done an incredible job, not only the authoring the book, but producing and working with the Betrayal Series. So my hat's off to you. You have done an incredible job, and I really appreciate and thank you for being on this show. I think people are going to learn an awful lot. And Tom, thank you very much for doing this for me.
Marvelous. Thank you so much. It was really a pleasure to be with you.